Hi, I'm Dania. I'm a CRNA student at Endeavor Health University, and we're going to be doing a head-to-toe assessment on my patient here. Normally, we would be in a hospital setting, and my patient would be wearing a hospital gown. I've already performed hand hygiene and taken my patient's vital signs, and everything is within normal limits. Hello, are you able to tell me your name?
Hi, my name's Reneen.
Do you know the date today?
April 18, 2026.
Good job. Where's our location?
Orland Park.
And can you tell me the president?
Trump.
Perfect. Then the first thing I'm going to do is I'm going to do something called the Romberg test. So I'm going to have you stand up and close your eyes. And what I'm doing here is I'm assessing just to make sure you're not dizzy or there's no swaying or anything. Are you good?
Mm-hmm.
Okay, perfect. Romberg test negative. You can have a seat. Next thing we're going to do is test your cranial nerve 1. So that's the olfactory. So I'm going to have you close your eyes. And I'm going to close your nostril for you and tell me what you smell. Good.
Alcohol.
Perfect.
Alcohol.
Perfect. So for cranial nerve 2, we would ideally have a Snellen chart, and I'd be able to assess the patient's cranial nerve through that, but we do not. But in the event that we did, we would use that. For cranial nerves 3, 4, and 6, I'm going to check your pupils, okay? I'm just going to take this pen light and take a look. Okay, perfect. Eyes are round and reactive. Consensual light response is great. I'm gonna also have you just follow my pen, okay? Perfect. I also have this cotton ball. What I'm gonna do is just touch your cornea a little bit, and I'm just gonna be checking for like a blinking reflex. Perfect. Okay, Reneen, the next thing we're gonna do is your cranial nerve 5. So what I'm going to do is I'm gonna have you close your eyes. I'm gonna take that same cotton ball and I'm gonna touch different parts of your face and just tell me where you could feel the touch, okay?
Forehead. Left cheek. Right cheek. Chin.
Perfect. Reneen, for your cranial nerve 7, can you smile for me and raise your eyebrows? Perfect, just puff out your cheeks. Perfect, cranial nerve 7 intact. For cranial nerve 8, I'm gonna do something called the whisper test. I'm gonna go on different sides of you. I'm gonna whisper something and then just repeat what I said, okay?
Okay. 45. 35.
Perfect. If I had a tuning fork, I would ideally do something called the Weber test and the Rhine test. For the Weber test, what I would do is I would bang the fork and then have a pitching sound and put it over her forehead like this. And then ideally she would hear both sounds of the ring equal in both ears bilaterally. For the Rhine test, I would do that same exact thing, but I would put it one on her mastoid and then on her ear, or like a little bit behind her ear, like in front of it, just so that you could hear bone and air. And then in an ideal situation, she would hear the sound louder in the air. Okay, next we're gonna do cranial nerves 9 and 10. Can you stick out your tongue and say ah? Okay, perfect. I see that her uvula is symmetrical and midline. For cranial nerve 11, I'm gonna have you shrug your shoulders. Perfect, go ahead and put them down and then just turn your head for me side to side. Perfect, and then cranial nerve 12, I'm gonna have you stick out your tongue again and then just move your tongue side to side. Perfect, all cranial nerves intact. All right, next I'm just gonna just take a little quick peek at all your face for you. Okay, looking at the patient, I see that her head is midline, normal cephalic. I can see that she's symmetric bilaterally. There's no deformities, no lesions present. I can see that her face is symmetrical, eyebrows are intact and symmetric as well. She has a normal skin color, no abnormal movements noted. Her trachea is midline. Carotid pulses are present. And then no thyromegaly noted. No obvious JVD. Okay, moving on, we're gonna just check the range of motion in your neck. So I'm gonna have you flex your neck forward, perfect, 45 degrees, and then can you extend back for me? Okay, perfect, that was 55 degrees. I'm gonna have you turn your head side to side. And then go from your ear to your shoulder. Okay, perfect, full range of motion. Did you have any pain?
No.
Good. Next, we're gonna go ahead and palpate. I don't see any masses, I don't see any lesions. Her hair is intact and symmetrical throughout her head. Excuse me, next I'm gonna go ahead and check your temporal artery, so I'm gonna palpate. Okay. Did that give you any pain or tenderness?
No.
Okay, perfect. Next I'm gonna do your TMJ, okay? So open and close your mouth. Again for me. Perfect, smooth movement. Did you have any pain doing that?
No.
All right, I'm gonna check your Chevig-Steins. So I'm just gonna tap your facial nerve and I'm assessing for any twitching, which I do not see. So Chevig-Stein is negative. I'm gonna assess your salivary glands. So I'm gonna start with your parotid. Submandibular and your sublingual. No enlargement, no masses. Did you have any pain or any tenderness while I was doing that? Okay, perfect. Next, I'm gonna check your sinuses. So I'm gonna check your frontal sinuses and your maxillary. Okay, and did you have any tenderness? No swelling noted either. I'm just gonna quickly check your lymph nodes. So I'm gonna start occipital, preocular in front of your ears a little bit, postocular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, infraclavicular. I'm gonna check your epitrochlear over here. And then I'm not gonna check her popliteal or her inguinal, but we're assuming that they're also intact and there's no swelling or anything noted abnormally. Next I'm gonna do the thyroid palpitation. I'm just gonna have you move up a little bit. Perfect. I'm gonna be standing behind the patient. I'm just gonna assess your thyroid, okay? Any tenderness?
No.
Any pain?
No.
Can you swallow for me? Perfect. Thyroid moves symmetrically upwards with swallowing. I don't see any nodes or feel any nodes. All right. Can you open and close your mouth? And move your jaw for me side to side. Perfect. All right. If you don't mind, I'm just going to use the bell of my stethoscope and listen to your carotids, okay? Okay, I don't hear any breweries and I listen to your carotids and they're equal bilaterally. All right, I mean, first we're gonna do something called the confrontation test. So just kind of tell me when you can see my fingers, okay? And just keep your head straight for me.
2.
Perfect.
2.
Perfect, and then I'm gonna test your peripheral vision. So just close one eye. What number am I holding up?
2.
All right, and close the other eye.
2.
All right, perfect. We would ideally do a near vision test called the Rosenberg test if we had the stuff for it, but we don't. But I would hold it 14 inches from your face, and then we would assess nearsighted vision like that, okay? Next thing I'm gonna do is do EOM. So I want you to keep your head straight. Just follow my finger. Okay, perfect. Also, looking at the patient, I see that her eyebrows are full and symmetric. Her eyelashes are evenly distributed. I can see that she has her just face in general without any edema. There's no lesions, there's no discoloration looking at her. Her peripheral fissures were symmetric. Yeah, perfect. And just orbital area in general was without edema. Okay, so next we're gonna do a little bit of the lacrimal apparatus. So what I'm gonna go ahead and do is just look at you, and I see that there is no redness, there's no drainage, there's no swelling. Her sclera is white with no lesions. Conjunctiva is pink and moist. I can see that her cornea is clear, round with no lesions. There's no swelling, there's no redness. We already tested her corneal reflex earlier as well as the corneal light reflex. Both were present and intact. Her iris is intact and her pupils are equal and reactive, all of which that we've tested earlier as well. So for your lacrimal apparatus, I'm just gonna palpate, I'm gonna touch your face, okay? Okay, there's no tenderness, there's no swelling, there's no drainage. And ideally, Deneen, I would have a fundoscopic exam, but I don't have the ophthalmoscope with me, but ideally I would check and make sure that your red reflex is present bilaterally. I would make sure that your optic disc is bright and yellow and well defined. I would make sure that your retinal vessels were intact and that your retina was uniform in color and that there would be no abnormalities or lesions, okay? I'm gonna take a look at your ears. Okay, I see that her ears are symmetric bilaterally. They're proper alignment with her eyes. And there's no lesions and no discoloration. I'm gonna take a pen light. I'm gonna take a better look at your ears, okay? Perfect, pink, moist, intact of the canal, and then there's no drainage either. Also, ideally, I would have an otoscope, and what I would do in that case and situation, I would pull your helix up and back, and I would look at your tympanic membrane. Ideally, it would be pearly, gray, translucent. Your bony landmarks would be visible. I would have a light reflex and be able to see the 5 o'clock in the right ear, 7 o'clock in the left ear, and then also we did previously assess your hearing earlier with the cranial nerves. All right. I'm gonna check your nose, so I want you to close one nostril at a time and just breathe so I can make sure your patency is perfect. Perfect, and I'm just gonna take a look. Okay, I can see that your mucosa is pink and intact, your turbulence is intact, there's no deformities, your septum is midline, I don't see any edema, I don't see any drainage. So next I'm gonna move on to throat and mouth, okay? Can you stick out your tongue? Lift your tongue for me. Say ah. Perfect. I see that your lips are symmetrical with no lesions. Your buccal mucosa was pink and moist. Your Stenson duct was not obstructed. I could see that your teeth, you had 1 through 16 on the upper and 17 through 32 on your lower. Your hard and soft palate were pink, moist, and intact. Your tongue was midline, it moved appropriately. Under your tongue, your Wetton duct was not obstructed, and your frenulum, it was intact. Your tonsils were 2 out of 4 bilaterally, and there was no inflammation or exudate. Also, I'm just gonna finally palpate your ears, okay? I'm gonna be testing your pinna, your tragus, and your mastoid, and I'm gonna be looking for any tenderness, okay? Any pain or anything? Okay, perfect. Thank you, Deneen. All right, Deneen, can you first just kind of stick out your hands for me? Let me just take a look. And then can you just do this for me? Try to do it like this way. Perfect. Okay, so really what I was looking for, I saw that your capillary refill is less than 2 seconds. I was looking for clubbing. I didn't see any clubbing, no cyanosis, no rashes, no lesions, no edema, no discoloration, and your skin color was pink and uniform. The next thing I'm gonna do is we're gonna sit for a minute and I'm gonna assess your respiratory rate. Okay, perfect. Respiratory rate was 16. Your pattern was regular and unlabored. I didn't see you using any accessory muscles. Next thing I'm gonna do is I'm gonna inspect your chest. Normally I would have you take your shirt off, but for right now we'll leave it on, okay? I'm looking for no pulsations of your pericardium. I'm seeing that your thorax is elliptical and, symmetric. I see your coastal angle is less than 90, and then I can also see that your anterior posterior transverse ratio is 1 to 2. Okay, so I'm also inspecting your venous pattern. I see your venous pattern is intact, and then I see that there's no distension and there's no abnormalities of your chest wall or your veins in the front or your back. All right, Deneen, the next thing I'm gonna do is I'm gonna start with palpitations, okay? So I'm gonna palpate your trachea, and then I'm gonna go down your chest, okay? All right, I was assessing for any tenderness, masses, or crepitus, and I had no abnormalities noted. So what I'm gonna do next is I'm going to kind of feel the different areas of your heart, and I'm gonna assess, okay? So the first thing I'm looking for is your aortic area, which is the second intercostal space on your left. I'm gonna go to your pulmonic, which is the second intercostal space. I'm sorry, aortic is on your right, pulmonic is on your left. I'm gonna go to Erb's point, which is your third intercostal on the left, sternal border, and then I'm gonna do tricuspid, which is the fourth one, and then mitral apical on your fifth midclavicular line, okay? Perfect. There was no pulsations and no abnormalities noted. I'm just gonna deep breathe for me. And I'm looking for your chest expansion. I see that it's symmetric. It's about 5 to 7 centimeters. Do it again while I'm palpating you. Perfect. And I'm just gonna palpate your PMI, which is gonna be on your left side. It's the fifth intercostal space, midclavicular line, okay? Perfect. It's less than 2 centimeters, which is normal range, okay? Next thing I'm gonna do is your tactile firmness. I'm gonna put my hands on your chest and then I'm gonna move down and I want you to say 99 every time my hands move, okay? I'm gonna start at the angle of Lewis.
99, 99, 99, 99, 99, 99.
Okay. I could feel that as I was moving outwards, it decreased peripherally, which is normal and great. All right, Anine, the next thing I'm gonna do, I'm gonna move you a little bit if you don't mind. All right, Anine, I'm gonna go ahead and percuss your anterior chest, okay? Okay, perfect. I did it bilaterally and I was able to notice tympany in your lung fields and dullness as I got away from your lungs. So next I'm gonna go ahead and do your back. I'll have you stand up if you don't mind. Oh, that's perfect. I'm gonna assess all lobes from top to bottom, okay? Can you be taking deep breaths while I'm doing this? So Deneen, what I'm assessing here is the diaphragmatic excursion. And as you're exhaling, I can tell that your dullness, you go from dullness to tympanic and then it moves about 4 to 6 centimeters, which is letting me know that we're in the normal range. Because it goes to tympanic again once we go down. And it was symmetric bilaterally. So I'm gonna take a listen real quick. I'm gonna start at your neck, okay? I'm gonna listen to your back. Okay, so I noticed that your trachea had brachial sounds, which is great. I also noticed that in your upper chest you had bronchovesicular sounds, and then also in your peripheral lung fields you had vesicular sounds. It was a clear bilaterally and then no abnormalities, okay? Now I'm gonna test your voice sounds. So what I'm gonna do first is something called the whispered precolography, and when I go behind you, I'm gonna listen to your lung fields and I want you to whisper 1, 2, 3, okay? Do it every time I move my hand, okay?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, perfect. The sound is muffled, which is normal. The next thing we're gonna do is called a bronchophy, and then what I'm gonna do is the same thing, but this time you're gonna say 99, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. Also there I heard muffled sounds, which is again normal. We're gonna do one more test. We're gonna do it's the last one. It's called Agafi, and what you're gonna do is you're gonna say E, and I'm gonna be listening again, okay?
E, 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 E.
Perfect. I was just making sure that I didn't hear anything that kind of sounded like ah. So that was great. Thank you. All right, Anine. So I'm just going to quickly listen back to your heart again. We're going to do those same areas that I palpated earlier. So your aortic, your pulmonic, your Erb's point, tricuspid, and mitral, okay? Perfect. Your S1 and S2 were clear. I didn't hear any murmurs, and I didn't hear an S3 or an S4 sound. Next, what I'm going to do is I'm going to go ahead and feel some of your pulses, okay? I'm going to start with your carotids. I'll do one at a time. Perfect. And then your brachials. Perfect. And your radials. Perfect. And your ulnars. Perfect. I would, but I'm just not gonna for this video right now. Feel your femoral, your popliteal, your posterior tibial, and your pedal pulses, okay? But otherwise we would. What I'm gonna do something, it's called an Allen's test. So just put out your arms for me. You can rest them. And I'm gonna go ahead and occlude your, I'm gonna have you clench your fists, and I'm gonna occlude your radial and your ulnar arteries, okay? All right, and then I'm gonna release the ulnar artery and have you unclench your leg, and your arm, and I can see that you have a brisk refill. So that lets me know that there's really good perfusion, and in the case that I needed to put in an art line, we would be able to, okay? Next, what I'm gonna do is I'm gonna assess for some DVT assessment. I'm gonna have you kick out your legs. You're a little tall, aren't you? I'm gonna have you kick out your legs, and what I'm gonna do while your legs are extended is I'm gonna dorsiflex them back, and I want you to tell me if there's any pain, okay?
Okay.
So let's kick out your legs. Your legs are extended. I'm gonna push your foot back and dorsiflex. Is there any pain?
No.
Okay, I did that to bilateral legs, and with no pain, that tells me that that's a negative sign, okay? So that's great. All right, next we're gonna do a JVD assessment. So what I'm gonna do is I'm gonna make sure that you're about 30 to 45 degrees up, and we have this nice pillow under you that's keeping us with that. And I'm gonna measure from the angle of Lewis to the top of your neck, okay? All right, it's about 2 to 3 centimeters, which is normal. Had it been greater than 4, we would consider that abnormal, okay? I'm also gonna do a hepatojugular reflex, so I'm gonna have you completely supine. So I'm gonna take this pillow out. Okay, what I'm gonna do is I'm going to put pressure on your abdomen, and I'm gonna observe your JVD for about 30 seconds, okay? Okay, it's been about 30 seconds, and I saw a temporary rise in pressure, and then it fell back to normal after the pressure. So that was normal result, okay? While I have you laying down, I'm just gonna take a side view of your abdomen. Ideally, in this situation, you would have your shirt off, your clothing off, but for just the video and the situation, we'll keep your clothes on, okay? So I see a side view, abdomen is flat with no distension or abnormalities. Okay, Now that your shirt is technically off, what I'm gonna do is I'm just gonna observe. I don't see any signs of retroperitoneal bleeding. I don't see a Cohen sign. Excuse me, I'm just gonna turn you. Perfect, and I'm gonna look at the other side. Okay, I also don't see a Gray Turner sign. There's no visible lesions or any scars. I don't see any abnormal movement, and I see just minimal movement with respiration, which is great. I'm gonna grab my stethoscope. And with the diaphragm, Renine, I'm gonna listen to all 4 of your abdominal quadrants, okay? I'm gonna start with the right lower. I'm gonna go to the right upper, the left upper, and then I'm gonna do left lower, okay? I'm listening for bowel sounds. Okay. Ideally, in a more normal setting, I would spend a lot longer there, but bowel sounds were present. Next, I'm gonna go ahead and listen again for some vascular sounds. So I'm gonna listen for your aorta vascular sound. I'm gonna listen for that right near the umbilicus, and then for your renal arteries, I'm gonna listen right above the umbilicus on the right and left sides. And then for your iliac arteries, I'm gonna listen a little bit lower on the right and left sides. And then I won't listen to your femoral just for the video, but if I were, it would be a little bit further down, okay? Okay, perfect. There were no bruits heard. Okay, now I'm gonna do some abdominal percussions. I'm gonna start with your liver, Deneen, and what I'm gonna do is I'm gonna focus on the right lower quadrant of your abdomen. I'm gonna start at your nipple line, and then I'm gonna be able to hopefully identify your upper border of your liver with the dullness sound. And then as I move a little bit lower, I should be able to find the lower border once I lose that dullness sound, okay? Starting at the nipple line. Perfect. I see that your liver is about 8 centimeters, which is normal. Did you have any tenderness?
No.
Okay, perfect. No pain or anything like that?
No.
Sounds good. There is another way that I could assess your liver. It's called the scratch test. I'll use my stethoscope for this. What I'm gonna do is I'm gonna put my stethoscope on your nipple line, and then I'm just gonna scratch downwards. And then when I hear a change in sound, that's gonna be able to identify the liver borders for me. And I'll know that when I'm over the liver, the sound will be a lot louder. Perfect. I also did notice that when you, with inspiration, your liver descends 1 to 2 centimeters, and I noticed with expiration, your liver was rising 1 to 2 centimeters, which is great. The next thing I'm gonna do is I'm gonna do your spleen percussion. I'm gonna be on the left side around the 11th intercostal space and the anterior axillary line. I will say that in general, the spleen is a little bit hard to palpate just because it's protected by our ribs. I'm just looking to make sure there's no dullness, because in the event that I would hear dullness, I would think of splenomegaly, okay? Perfect. All right, and the next thing I'm gonna do is I'm gonna start with a superficial palpation in general of your abdomen. We'll do this all 4 quadrants. We're gonna start from the right lower quadrant and go clockwise from there. And I'm just gonna be superficial again, so it's just gonna be about 1 centimeter, okay? What do you think? Any pain, any tenderness, anything?
No.
Okay, I also didn't observe any masses, so that's good. I'm gonna go a little bit deeper. I'm gonna do the same thing, but just a little bit deeper this time around, 5 to 8 centimeters. How did that feel, Deneen?
No pain.
Okay, good. No tenderness either?
No.
And also no masses and no abnormalities. I will say that the spleen, kidneys, and your reproductive organs are not palpable, but that is normal because of the anatomy of the human body, okay? I want to do something called the umbilical reflex. I'm just going to scratch lightly around your umbilicus, and what I'm looking for here is like contraction towards the stimulus, okay? Perfect, intact. All right, I'm gonna do one more thing. I'm just gonna be assessing kind of the tenderness of your kidneys. Okay, so perfect. I'll have you sit up. And again, in this event, you're not, you're probably in a hospital gown, so your back is more exposed. I'm gonna percuss over your CVA, which is back here, and I'm gonna be looking for any tenderness, okay? How was that?
No pain.
Okay?
No pain.
Perfect. So it looks like the patient is negative for pyelonephritis. Renine, I noted it on my assessment, but in case I didn't tell you, when I was doing your pericardium, when I was assessing and palpating your pericardium, I didn't feel any heaves, thrills, or lifts. And also when I was auscultating your heart, I used the bell for all 5 areas and the diaphragm for all 5 areas. Yeah, I had that in my note, but just in case you wanted to. All right, Anine, we're gonna go ahead and finish up with some more neurological things, okay? So first I'll start by testing your cerebellar, and what I want you to do is put your finger on your nose and then touch my finger. Every time, do it again, okay? Okay, perfect. Movements were accurate and smooth. I'm gonna do something called the rapid alternating movement, so I want you to take your hands and just quickly go back and forth. Perfect. Movements coordinated, hands back and forth smoothly. We already did the Romberg test earlier, so we won't do it again. I'm going to do something called the pronator shift, so I want you to close your eyes. Just extend your hands out for me. Perfect. Keep it like that for just a second. Okay, good. Really, I was looking for a drift and I didn't see anything, so that's great. Next thing I'm going to do is I'm just going to test your sensory. So I'm going to take this cotton swab, and I want you to keep your eyes closed. And then what I'm gonna do is I'm gonna touch you somewhere and just tell me where.
Arm.
Which one?
Left. Right arm. Right leg. Left leg.
And were those sharp or dull?
Dull.
Okay, perfect. And then I'm gonna take a different object now, and I'm gonna do kind of the same thing. So just keep your eyes closed, okay?
Left arm. Right arm. Left leg. Right leg.
Did you feel a sensation?
Yes.
What kind?
Just like hard.
Perfect. All right, so I want to test temperature, so I'm gonna have this warm cup of coffee. Just warm.
It's warm.
You feel it?
Warm. Warm. Warm.
Okay, and then I'm also gonna take my cool popsicle.
Cold. 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 Cold.
Okay, so next what I want to do is test your cortical sensory. So I'm going to keep your eyes closed for all of these. I'm going to do something called sterigenosis, which I'm going to place something in your hand and see if you could tell me what it is.
A pen.
Perfect. Keep your eyes closed. I'm going to draw a number on your palm and tell me if you know what the number is.
2.
Perfect. And then I'm going to do something called 2-point discrimination. So tell me how many points are touching you at this point.
1.
Okay. I'm going to come behind you.
1.
Okay.
1. 2.
Perfect, Janine. I'm also gonna do something called, point localization. So I'm gonna have you keep your eyes closed. I'm gonna touch you somewhere, but I want you to tell me where I touched you. And then I want you to actually touch it yourself.
Left arm.
Perfect.
Right leg.
Perfect. All right, I'm gonna do something called procipiration. So I want you to keep your hand up. Is your finger up or down?
Up, down.
Perfect, good job. All right, Anine, what I wanna do next is test your muscle strength. So you can open your eyes now. Give me your hands, please. And like, I want you to do some resistance. Push me and then pull me towards you, okay?
Okay.
Good job. We're gonna do the same thing with your legs. Kick out. Perfect. Pull back. Perfect. We're gonna do plantar flexion, so push down. And dorsiflexion. Perfect. Muscle strengths were 5 bilaterally, which is normal. A 0 would have been just like absolutely no contractions at all. Next, I'm going to test your deep tendon reflexes. We don't have the necessary equipment, but if we did, what we would do is I would test your biceps. So I'm going to have you put your arm out like that, and I would test her like this, and then we would see her arm flex up. For triceps, we would kind of do this, and then I would just punch her triceps, and we would see her arm extend out. For brachioradialis, I would tap your forearm, and I would kind of see your wrist come up like this. We would see that wrist flexion. For patellar, we'd see a leg extension, like that. And then for Achilles, we'd see plantar flexion. And then reflexes would obviously be bilateral, and they would be intact. For superficial reflexes, Janine, we already did your abdominal reflex previously, so we don't need to do it again, okay? I'm going to do something called, well, I'm not actually going to do it, but for the sake of the video, we do the Babinski. And what I would do is I would kind of stroke the bottom of your foot, like the sole of your foot, and your toes would flex, and that would be a normal / negative sign. We will do some meningeal testing. So what I'll have you do is put your neck, flex it, and extend it. Do you feel any pain?
No.
Okay. If I can have you lay down, Janine. Perfect. We're going to do the Koenig sign. So what I'm going to do is I'm going to lift your leg up, and I'm looking for any pain or resistance. Anything?
No.
Okay, we'll do the other leg. Any pain or resistance?
No.
Okay, and then we'll do the Brudzinski sign. So right now I see you're completely flat. I'm going to have you flex your neck up, and her legs remain. There was no hip or knee flexion, which is like the right thing that we're looking for. All right, last thing that I need, if you could just go ahead and stand for me. I'm actually going to just kind of look at you walk, okay? Back and forth. Perfect. And in your gait was balanced and symmetrical.